Hey everyone, welcome back to Clinical Physio. I'm Khalid Maidan, and in today's video I'm going to be talking to you about a really important respiratory condition, which is asthma. We're going to be talking to you about what asthma is, what happens when your patient has an asthma attack, and some of the key ways that you can help your patients manage their asthmatic condition. So, without further ado, let's dive in. So asthma is a long-term respiratory condition. It's normally diagnosed when a patient is a child but continues into adulthood. Patients with asthma are susceptible to an inflammatory response of the lung airways, which can happen as a result of certain triggers. Examples of triggers could be airborne substances such as dust particles, smoke, or grass or tree pollen, or physical triggers such as a cold or strenuous exercise. So why does an asthma attack occur and what happens during an asthma attack? Here we can see the normal lining of the lungs with a relaxed state of the muscles around the lining of the airways. When a patient experiences one of their asthmatic attacks, a couple of reactions take place. First, they may experience a tightening of the muscles around the airways. This can cause the airways to become constricted or narrowed as they swell. Also, we may find that excessive mucus is produced as an inflammatory response, and all of these reactions create a sudden difficulty in breathing, where the patient may experience a variety of signs, potentially including coughing, wheezing, chest pain, and/or a shortness of breath. And all of these signs are as a result of the aero narrowing that we mentioned earlier. Now, you may well find that your patient has different inhalers that they use in order to manage their asthmatic condition, a reliever and a preventer. A reliever is an inhaler which contains medication that allows the patient to instantly calm down their airways when they are having an asthmatic attack. A preventer is a more long-term daily use inhaler that they can use to reduce the sensitivity and inflammation to their airways over a longer period of time. Naturally, as both of these are medications, it's very important that they have these prescribed and regularly checked by a doctor, particularly if your patient finds that they have been having to use their reliever inhaler more frequently, potentially because they are experiencing more regular asthmatic attacks. So as physiotherapists, we may be helping patients in the period of time after they've experienced an asthma attack or in the long-term management of their asthma condition. And in both scenarios, it may well be that exercise therapy is a tool that we use. But one thing that's really important to mention within our exercise therapy is to make sure that we are not inducing bronchospasm, which means a spasm of the lung airways. You can imagine that if our patient does have a bronchospasm, it can be a possible trigger that causes an asthma attack in itself. Therefore, we want to make sure that we are encouraging really slow and controlled breathing with these patients. Here, you may find that doing something like blowing bubbles, playing blow football using a straw, or using a bubble pep might be a really nice way to encourage those slow breathing exercises with your patients. Now, the other thing to think about is that asthma could be a very stressful or emotional condition to deal with. It might be that your patients are worried about what might possibly trigger their asthma, or indeed what will happen to them when they have an asthmatic attack. So it's really important for us to educate, reassure, and empower our patients, helping them understand what their inhalers do for them, helping them with relaxation exercises, and making sure that they feel confident that they know what to do in order to help manage their condition and therefore reduce any anxiety that they have about their asthma. So guys, thank you so much for watching today's video. I really hope you've enjoyed it. And if you do, please head over to our Instagram account @ClinicalPhysio so you can see even more from us. But otherwise, we hope to see you again really soon, right here on Clinical Physio.